between the Directorate of the Health Services, the Government of Goa, Tata Memorial Center for the Cancer Epidemiology and University of the Experts. Amongst us, the Honorable Health Minister, Sri Vishwajit Rani, from the Directorate of the Health Services, Dr. Rupa Naik and other dignitaries, from the Tata Memorial, Dr. Dikshit, Professor Jha, and from the Oxford, Dr. Sara, Dr. Femin, Dr. Westin, and the rest of the dignitaries on the virtually we join. Today marks a historical moment in the healthcare journey of Goa, and we have gathered here for signing of the Memorandum of Understanding, the Goa Cares Longitudinal Cohort Study 2026, an initiative that reflects our government commitment towards building a healthier, stronger, and more informed Goa. I congratulate the Directorate of the Health Services, the Center for the Cancer Epidemiology at the Tata Memorial Center, Mumbai, and the University of the Oxford, United Kingdom, for coming together to create this landmark partnership. These collaborations bring together the expertise of one of the India's premier cancer research institute, one of the world's leading university, and the Government of Goa, with the shared vision of improving the public health through the science, research, and evidence-based policy making. Friends, the healthcare being with the understanding why the disease occurs, how they affect people, and how they can be prevented before they become the burden on the family and society. The Goa Cares Longitudinal Cohort Study 2026 represents one of the most ambitious population-based public health research initiatives ever undertaken in our state. And through these initiatives, Goa joins the select group of the region and around the world, and that is in conducting the large scale, the long-term health studies designed to understand the changing health profile of their populations over the several decades. This is not merely the research project, it is an investment in the future health and well-being of the every Goan. Over the last few decades, India has made a tremendous progress in healthcare. However, we are also witnessing the rapid rise in non-communicable diseases such as the heart disease, diabetes, cancer, chronic respiratory illness, and the lifestyle-related conditions. These diseases have become one of the biggest health challenges of our time. In Goa, nearly 3/4 of the overall disease burden is attributed to the non-communicable disease. Conditions such as ischemic heart disease, type 2 diabetes, chronic obstructive pulmonary disease, and other lifestyle-related illness and increasing affecting our population. High blood pressure, obesity, high cholesterol level, and environmental factors have emerged as the major risk contributors. The data generated through the Goa Cares will help us to answer the critical questions. Why are the certain diseases increasing? Which populations are most vulnerable? What role do the lifestyle and environmental factors play? How can we identify the risk, earlier interventions before the disease develops? The most importantly, how we can create the healthier future of the people of Goa. The answer of these questions will help to shape the future healthcare policy, strengthening disease prevention program, improve the screening strategies, and support better allocations of the healthcare resources. The knowledge generated through this study will not only benefit Goa but will also contribute to the national and the global understanding of the population health and aging and the non-communicable diseases. The Goa Care Studies is designed to follow approximately the 1 lakh adults between the age of 25 and 70 years over the period of 10 years. This makes it one of the largest and most comprehensive health study ever undertaken in Goa. Participants from both the urban and rural areas and will contribute to the valuable information regarding their health, lifestyle, environment, and family history. The researchers will study the factors such as diet, the physical activity, environmental exposures, genetics, the blood pressure, cholesterol level, the blood sugar, and the several other indicators that influence the long-term health outcomes. The objective is simple and powerful: to understand how disease develop, identify the risk factor early, and create effectively strategies for prevention. Friends, for the many years, the healthcare system across the world focused on the primary on treatment. Today, the modern healthcare is increasingly focused on prevention. The greatest success of any health system is not only measured by the number of the hospital it builds, but by the number of the disease it prevents. The knowledge generated through this study will help us to design targeted intervention, strengthening the screening program, improving the healthcare infrastructure planning, optimizing the resource allocations, and formulate a policy based on the real evidence rather than assumption. Most importantly, it will help us to save the lives through the early detection and prevention action. And we have recently launched two healthcare campaigns in the Goa with the vision of making stronger and implementation and creating the awareness regarding the importance of the preventive healthcare and for the well-being of the people of Goa. Check by Dutor launched in the International Women's Day. It is targeted healthcare checkup of women of our families. Our mothers, our sisters, daughters, spouse, even though they are the one of that take care of our health and well-being of all the time. In their health and that goes unnoticed. I am proud to note that the 50,000 plus women benefited from this health camp. We followed the initiatives Health with Ayurveda, Check by Doctor 2.0. And through this drive, and we have ensured that the traditional and highly effective medicines, the practice of the Ayurveda is embarked and widely by the people for a more robust and healthier lifestyle. The Government of Goa has consistently worked towards the strengthening the healthcare services across the state. Today, our hospital, community health centers and primary health centers conducts a regular screening program for diabetes, hypertension, breast cancer, cervical cancer, tuberculosis, anemia, cardiovascular diseases and several other health conditions. Extensive preventive screening services are already available across the district hospital, sub-district hospital and community health center through Goa. Through the initiatives such as the NCD screening programs, eye breast screening facilities, anemia control program, the maternal health services, cancer screening program and specialized health camps, and we have continuously expanded access to the preventive health care. The Goa Care study will further strengthen these efforts by providing scientific evidence that can guide the future intervention and make our healthcare system even more effective. One of the most significant aspects of these initiatives is that it is a position Goa is emerging center for the advanced public health research and international scientific collaboration. The findings generated through this study will not only benefit Goa, they will contribute to the India's understanding of disease patterns, aging, environmental exposure and lifestyle related health risks. The knowledge generated here can influence the public health policy nationally and even globally. This is a matter of great pride for the every Goan. Friends, the every government is entrusted and with the responsibility of thinking beyond the present generation. And the decisions we take today is determine the quality of the life enjoyed by our children and the grandchildren tomorrow. The Goa Care's longitudinal cohort study reflects this long-term vision by understanding the disease pattern today and we are preventing sufferings tomorrow. By investing in the research today, we can improve the healthcare outcomes for decades to come. As we formally launch these landmark initiatives, I once again congratulate the Health Minister Vishwajit Rane and also the Directorate of the Health Services, Tata Memorial Center, Center for the Cancer Epidemiology and the University of the Oxford and all the research healthcare professionals and officials who have contributed to making these collaborations possible. The University of the Oxford and will contribute to the advanced scientific and academic support in the study methodology. It is in biostatistics, longitudinal data analysis, global research standard and interpretations of the findings, and thereby ensuring that the studies align with the international accepted research practices. Together, let us build the future where the policy is guided by the evidence, healthcare is guided by prevention, and every citizen has the opportunity to live healthier and longer life. Once again, congratulations to all of you. Thank you, one and all.
तुम्ही पळतात GNH.
दाने दाने में आरोग्य प्राप्तिरस्तु, दाने दाने में सौभाग्य प्राप्तिरस्तु। अमृत जैसा इसका स्वाद, ये है पौष्टिकता का प्रसाद। कण कण में पंचामृता, रग रग में पंचामृता, तन मन में पंचामृता। पंचामृता, देश भर में पंचामृता, घर घर में पंचामृता प्राप्तिरस्तु।
शुद्ध भी, स्वाद भी, सेहत भी। पंचामृता खाओ, हेल्थी जियो।